Gold participants from around the world. I'm Fleur Bickford, Program Director and MC for Gold Learning. I'm chatting today with Birdie Meyer about her upcoming presentation titled Perinatal Mood and Anxiety Disorders, an Overview for Childbirth Caregivers and Educators. So Birdie, welcome. Thank you for being with us today.
Thanks for having me.
So we're just going to talk a little bit about your upcoming presentation, which is going to be part of our Gold Learning Online Symposium on Childbirth Education, which we are really excited about. And so just to tell our delegates a little bit about yourself, you've done a lot of work in the area of pregnancy and postpartum mood disorders. So I'd love for you to tell us a little bit about why this is such an area of passion for you.
Yeah, I've worked in this area now for 20 years, and honestly, when I first started, I knew nothing about this area. I took training from Postpartum Support International, and now I am a trainer with Postpartum Support International. And I absolutely love what I do. I say that to people all the time. I'm passionate because what I love is helping women feel like themselves again, to get better again, to understand what it is they're going through. I'm very passionate about this because this affects 1 in 7 women. It's so common. And many women suffer in silence, and there's no reason to be suffering in silence when there's help available. Also, 1 to 2 women in 1,000 will experience a psychosis, and that's a medical emergency. Women, it's in the top three leading causes of maternal death, and so that's really why I'm beyond passionate about it. I want mommies and daddies to enjoy their new baby and their family, and to understand what this actual the actual disease looks like.
Okay, thank you. It's amazing. Like those statistics are quite alarming. Just a number of people that are dealing with this, and such an important topic. And I'm wondering what your thoughts are on how things have changed, or maybe in some cases stayed the same in recent years. And I'm wondering, we know there's quite a stigma against mental illness. Do you feel like we're starting to make any kind of headway in that education and breaking down some of that stigma?
Yes, it's interesting. I say this all the time, and I mean it with my whole heart, and that is we've really come a long way, but we still have such a long way to go. And that's with the stigma, with the education, more and more people understanding, knowing where to look for help. When I hear a tragic end to someone's life and it was postpartum depression or anxiety or pregnancy depression or anxiety, or it was psychosis, I just think, oh, did they know where to turn for help? Were they getting the proper help? Stigma's still, I think, one of the hardest things to deal with. We're supposed to be happy and lovely and wonderful when we have a new baby or when we're pregnant, and that's not always the case. And so the shame still goes along with that. We still have the stigma of emotional illness itself. The U.S. Preventative Task Force just in January came out with all women should be screened during pregnancy and postpartum. And those are the same task force that decide when we get mammograms and when we get pap tests and all those things. So I'm hoping that will really bring more emphasis to watching for it, looking for it, especially if that is continues to go forward. So have we come a long way? Yes, in many ways. Do we still have a long way to go? Yes, when we still have OB care providers and the public still not knowing what perinatal mood disorders are. And psych care providers. I shouldn't pick on just OB care providers. Psych care providers, pediatric care providers, all still many that don't quite understand what it is.
That's great. And, it's great to hear you say that you feel like we have come a long way, because I think sometimes we look at the fact that we do have, still a long way to go, and it can be, sometimes easy to lose sight and get, a little disenchanted with feeling like nothing's really changed. So it's great, the fact that you've been doing this for a long time and you feel like we really have made some headway with it. It's great to think that, moving forward, we can continue to make that headway and those improvements. So that's fantastic.
Yes.
Maybe you can just tell us a little bit now about what you hope our delegates will take away from your presentation and be able to take back with them to their practices?
Sure. I want to give a great overview of perinatal mood disorders. And I want the delegates to take away how to teach this as an educator, as a childbirth educator, as a doula, as a lactation counselor, all the different roles the delegates play. I want them to take away from this. This is what perinatal mood disorders look like. This is what the blues look like. This is where we can find help. And to be able to teach that during prenatal classes, in lactation classes, like I said, as a doula, in the different roles that the delegates play, I want them to know how to teach this and how to help the people they're educating recognize it
That's
and know where to go
wonderful.
for help. Yeah,
Perfect. Such an important thing, and really looking forward to your presentation. So thank you so much for chatting with us today.
sure.
For our delegates who are listening, you'll be able to hear more from Birdie on our live symposium day, which will be Monday, September 12th, and Birdie will be presenting at 9 p.m. UTC, which is 4 p.m. Pacific Standard Time. So we look forward to seeing you then. Bye for now, everyone.